back to the second half hour of Las Vegas Morning Blend. I am Murray Sawchuk in for Sean today. JJ Snyder will be with us in just a bit. It's now November, which also means it's Movember. JJ is standing by with more on men's health issues and what we can do to be more aware. JJ?
You may have heard of the Movember movement. Each year, it grows in popularity across the country. Guys growing mustaches during the month of November to raise awareness of men's health issues. Prostate cancer in particular is no joke. And our next guests are going to break down all the facts for us this morning. Joining us now, Dr. McCraw, urologist and men's health expert, and Steve Cooper. He's a prostate cancer survivor and recipient of an artificial urinary sphincter. Gentlemen, welcome.
Hey, thank you for having us today. So yeah, in the spirit of Movember, which celebrates men's health, I don't have my mustache yet, so we brought some fake ones.
Nice.
But yeah, we wanted to talk about prostate cancer and then some of the effects that it can have.
Certainly. Let's start from the very top. If we get an overview first, doctor, for all the men watching in particular, how common is prostate cancer?
So it's actually very common. It's the second leading cause, or the second diagnosis of cancer in men overall, second only to skin cancer. And in fact, 1 in 9 men will be diagnosed with prostate cancer at some point in their lifetime. So it's very common. In spite of that fact, we've gotten really good at treatments nowadays.
Great.
Yeah.
Well, there are several options out there, and we're going to touch on a few of those options in just a moment. The interesting thing, though, is although the treatment has advanced, there are still side effects from the treatment. And can we talk about those?
Yeah, so when men come and see me, the 2 most common side effects that they complain about, one is going to be ED, and there are lots of great treatments for that. The other is going to be urinary incontinence or urinary leakage.
May I stop you? I'm sorry,
Sure.
I don't know what ED is.
Erectile dysfunction.
Ah, okay. Well, hey, you know what? It was an honest question.
Yeah, no, absolutely. And it's a big thing to them. But urinary leakage, they complain about a lot. And you know, of everything that I treat, urinary leakage is the most rewarding to me. You have guys coming in saying, you know, I used to be really active. I used to be able to play with my grandkids. And their prostate cancer was treated and great. You know, the 10-year survival after treatment of prostate cancer that's localized is about 98%. So we've gotten really good at that.
Great.
But these men are at home and they can't do what they love to do because they're afraid they will leak on themselves. So it really affects their lives.
Well, you know, women have a similar issue with incontinence. The thing is it affects your lifestyle every single day, doesn't it? It's very limiting.
Very limiting.
So interesting. Is there anything that can be done about that?
There are lots of things that can be done about that. So one thing is something called a urinary sling. It's a very simple procedure that can be done for mild to moderate incontinence. The gold standard for urinary leakage after prostate cancer surgery, and actually in some men even who have not had prostate cancer surgery but leak a lot, is something called an artificial urinary sphincter.
Yes.
And basically it's a minor surgical procedure. It only takes about 45 minutes to do. Patients go home the same day, but it can completely change their lives. So before, when they're at home, not able to travel, not able to play with their grandkids, now they don't leak anymore. They're very happy. They can go to church. They can do the things they used to love to do. So their prostate cancer is now treated, and they're not having to suffer the terrible side effects that come sometimes with that treatment.
Wow. All right. Well, this is a perfect time to talk to Steve, who's sitting with us. Thanks for joining us and sharing your story.
Thank you for having us.
Yeah, it's it takes a certain kind of guy to step forward and go, you know what, I'm cool with this. I want to tell other people about it.
Absolutely.
So you're a prostate cancer survivor.
Correct.
Yeah. First, tell us about your journey.
So I got diagnosed in 2012 with stage 4 prostate cancer, and as Dr. McCraw mentioned, you know, there's a lot of side effects that come with the disease. ED is one, and then also the urinary incontinence. For me personally, the urinary incontinence was the most concerning because I had been an alpha male, I was a CEO, I was in the Army, I was a police officer, you know, I was doing Ironman.
And you're like, hey, wait a second, this is so uncool.
And now I'm leaking.
Yeah.
And so imagine wearing diapers as a young 40-year-old adult who's single for 3 to 4 years. It was literally some of the worst times of my life.
Oh, Steve, my goodness. All right, so you had great results with the artificial urinary sphincter.
100%. So, and I do want to mention, I'm so glad that Dr. McCraw is here now in Las Vegas. I used to live here. And actually, I went to urologist in the valley saying, hey, you know, I just had surgery, I had radiation, and I started leaking because of the radiation, not necessarily because of the surgery, probably. And many of the doctors told me, well, just drink less water. And so,
Oh my goodness.
yeah, and imagine
Right.
when you're training for an Ironman and someone tells you drink less water. And so we're so glad to have Dr. McCraw in the community now here doing these types of procedures, because literally, you said it's rewarding. One of the greatest days of my life was when my urologist activated my urinary sphincter and I no longer was wearing diapers as an adult.
Oh my gosh. Yeah, that's a good trade-off.
Yeah.
I'm so happy to see that you've, reached regular health again. That's awesome.
Thank you.
It's funny with health, you don't come to really appreciate it until you've lost it for a while.
So
right?
well said.
And then you're like, oh, I'm back and I feel great. You have an event coming up where men around the valley can come down and kind of have an open forum and learn more about this.
I do, yeah. So I'm giving a talk at the Sunset Station Casino. It's on November 14th at 6 p.m. And that's the thing, we're just kind of spreading the word. We're taking questions from guys out there. Because that's the main thing, is that, like you said, one, some doctors don't know how to do these procedures. And so a lot of patients out there don't know that these treatments are available to them. So they suffer in silence. And so we're trying to get the word out and let people know. So the event is free. Anybody can come. We'd love to meet them.
Great. Thank you so much, Doctor. Thanks for being here, and thank you for sharing your story.
Thank you for your time.
Yeah, absolutely. If you would like to learn more about prostate cancer, attend the free Men's Health Talk November 14th at Sunset Station Casino. You may also visit fixincontinence.com or call the number right there on your screen. Boston Scientific, a proud sponsor of the Morning Blend.
Thanks, JJ. Now let's hear from our friends Pickler.